Master picking up knowledge. Picking up knowledge also we can use effectively this smartphone. Okay na? ఇప్పుడు నేను అడిగాను కదా వెంటనే పర్కషన్ అని వెంటనే కొట్టేసాను అనుకోండి చక్ 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 వచ్చేస్తుంది మీకు. You can answer anything. Okay. Iron Burger, his father was a wine merchant. So they were filling the barrels of wine and they were keeping it in the basements. So to check the barrels of wines whether there is empty or how much they are full, how much they are empty, they are going to percuss like this barrels. Percuss. So empty thing will give a sound of resonance. Okay. Filling will give sound of dullness. So at that time they were only making like this, but it is modified like plexer, pleximeter. Percussion. Iron Burger. Joseph Leopold Iron Burger. Joseph Leopold Iron Burger. Okay, percussion. So like this. So in medicine we have to learn, we have to follow certain protocols, we have to learn the medicine properly. FSR ga నేర్చుకోకూడదు medicine ని proper గా నేర్చుకోవాలి. Properly we have to learn. If you learn properly the procedure, you are going to shine in your future. You are going to shine in your job. Nobody will point out you, nobody will question you. So that's why if we follow the protocols, you will learn good medicine, you will become good doctors. Protocols. ధర్మో రక్షతి రక్షిత విన్నారా మీరు? ధర్మో రక్షతి రక్షిత అంటే ఏంటి? ధర్మాన్ని రక్షిస్తే అది మిమ్మల్ని రక్షిస్తుంది అంతే. ప్రోటోకాలో రక్షతి రక్షిత. Protocols of medicine treating a patient, if you follow the protocols, that will protect you. దాని ఉద్దేశం అది. ఓకేనా? ప్రోటోకాల్స్ ఎప్పుడు మిస్ కాకూడదు, ప్రోటోకాల్స్ ఎప్పుడు డివైడ్ కాకూడదు. Certain protocols we have to follow in the medicine, strictly we have to adhere to it. కాబట్టి నేర్చుకునేది ముందే నేర్చుకునేది ఏదో ప్రాపర్గా నేర్చుకోవాలి మెడిసిన్లో. అంతేగాని హెఫెజాడ్గా ఇష్టం వచ్చినట్టుగా నేర్చుకోకూడదు మెడిసిన్లో. సరేనా? సో దట్స్ వై టు ఇంపార్ట్ యూ సర్టన్ basic surgical skills we came here. My topic is infection prevention. What is infection? What are the infective organisms? Infective organisms ఏవేంటి? బ్యాక్టీరియా చెప్పండి. What is infection? Infection going to be by the bacteria, virus, fungus, spores. These are the microorganisms going to invade the human body, going to produce a disease. Okay, that is infection. What are the various? Who is he? What is his importance? Who taught you hand washing in your childhood? అన్నం తినేటప్పుడు పోయి చేయి కడుక్కొని రాబండి, చేయి కడుక్కొని తిను, అన్నం తిను, చేయి కడుక్కొని తిను. ఎలా తింటావు అన్నం? లేకపోతే మురికి చేతులు తింటావా అని చెప్పేసి మీరు చిన్నప్పటి నుంచి చెప్పారు కదా. మీకు మీ పేరెంట్స్ చెప్పలేదా? పేరెంట్స్ చెప్పుంటారు కదా. మీకు తెలుసా మరి ఎలా వాష్ చేసుకోవాలో తెలుసా? మీకు తెలిసిన పద్ధతి వేరు, ఇప్పుడు చెప్పబోయే పద్ధతి వేరు, క్వైట్ డిఫరెంట్గా ఉంటుంది. So this man is invented, Ignace. He is a great man, Ignace Semmelweis. He was an obstetrician. While he is doing the deliveries, they don't know before the importance of hand wash. So they were touching the patients. They are coming to the delivering mothers. So they were doing the deliveries with there were no gloves at that time. No gloves, just only with the empty hands they were doing the deliveries. So after doing the deliveries, the mothers used to die. Mortality rate, maternal mortality rate was very high at those times, maybe 60 to 70 per 100. Now what is the maternal mortality rate now in India? SPM, social and preventive medicine. What is the maternal mortality? So that's why Indian government is promoting the patient, promoting its people to go for the delivery in the hospitals, institutional deliveries. Okay. So this doctor observed why this so many deaths were happening in the obstetric ward. So he observed there is some mistake with the hands. So infection is coming from the hands of the residents and also PGs and also doctors and also nurses. So he applied, before doing the delivery, go and wash your hands. He applied this technique. Okay, this Ignaz Semmelweis pointer. First, madam. Yes, sir. See, this is puerperal sepsis. This is called as puerperal sepsis, which is contagious. This is by the transmission by the doctors and also medical students, those who are attending the women. So he observed, then he made a solution, that is hand wash. The solution for that prevention of the puerperal sepsis is hand wash. Okay, how you are going to wash your hands? మీరు జనరల్గా ఎలా వాష్ చేస్తుంటారు హ్యాండ్స్ని? వెళ్తారు, ట్యాప్ దగ్గరికి వెళ్తారు, సోప్ తీసుకుంటారు, చక్కచక్క అలా వాష్ చేసుకుంటారు, ట్యాప్ కింద మళ్ళీ పెట్టుకుంటారు, అనుకుని వచ్చేస్తారు, మళ్ళీ వచ్చేసి చేసేస్తారు. 2 types of hand wash are there: general or simple hand wash, surgical hand wash. 2 hand washes: general or simple hand wash while touching the patient or while before taking the food, everything like this. But before doing a surgical procedure, that is procedure of hand washing is entirely different. Okay, entirely different. This is Ignaz Semmelweis. Next, this man, who is a great man, ikkada photo cut ayipindi, Sushruta. Sushruta was an ancient surgeon before 400 BC. That means almost 2419 years ago, BC. So he belongs to this period, 400 to 800 BC. He was the father of Indian surgery. So he also applied some disinfection techniques, that is fumigation techniques. Fumigation ante aviri, వేడి నీళ్ళు కాయడం, ఆవిరిలో ఇన్స్ట్రుమెంట్స్ ని వేడి చేయడం, that is okay, disinfection techniques. He also clipped nails and hair. చూడండి, nails. సో మీరు ఎంతమందికి గోళ్ళు పొడుగ్గా ఉన్నాయి? చాలా మందికి ఒక్క వేలికి పెంచుకుంటారు గోళ్ళు, ఒక్క వేలితో గేళ్ళు పెంచుకుంటారు. చూడవే నాకు ఎంత పొడుగు పెరిగిందో, అరే చూడరా నాకు ఎంత పెరిగిందో, చూసావా చూడు ఎంత బాగా పెరిగింది, చూసావా ఇంత పొడుగు పెరిగింది. ఇట్లా పక్క వేలు, అదేంటో చిటికెన వేలకే పెంచుకుంటారు అందంగా ముద్దుగా గోళ్ళు పెంచుకోవడం. మీలో ఉందా? మీరు ఎంతమందికి ఉన్నాయి గోళ్ళు ఉన్నాయా? డాక్టర్లు గోల్డ్ ఉండొచ్చా? లేదంటే మీరు ఎంతమందికి గోల్డ్ కొరుకునే అలవాటు ఉంటుంది? ఇట్లా లేదంటే అమ్మాయిలు సిగ్గుపడినప్పుడు గోల్డ్ కొరుకుంటూ ఉంటారు. అవునా? కొరకండి. Nail beds are having millions of bacteria. These nail beds below these nails, millions of bacteria will be there. But even though we are not getting diseases, why? Immunity, body immunity. What is the intestinal immunoglobulin? IgA, IgG, IgE, IgM. ఏది? IgA. Intestinal antibody, IgA. That's why we are not getting many of the diseases. Even though we are eating without washing the hands also, we are not getting diseases because of IgA antibody in the intestines. Okay, sorry. So he advised clipping of nails and hairs, and also he cleaned with the flamed surgical instruments. Flames, that means heat lo flame lo surgical instruments ni heat chesevaru. So they used to disinfect, sterilize the surgical instruments in the dry heat. Dry heat means flame heat. So who is this man? Joseph Lister. What for he is famous? Joseph Lister is famous for the antisepsis. He is the father of antisepsis. He invented a solution called phenol. ఫ్రీగా వస్తే ఫినాయిల్ అయినా తాగేస్తారు. తెలుసా? విన్నారు ఎప్పుడైనా? ఫ్రీగా వస్తే ఫినాయిల్ అయినా తాగేస్తారు. విన్నారా? ఆ ఫినాయిల్ కనుక్కుంది ఈయనే. Phenol is nothing but carbolic acid. He used to disinfect or sterilize అనకూడదండి. Sterilization means no spores, no bacteria, no fungus, no organism, no microorganism should be there on the instrument. That is complete sterilization. So we can call it as antisepsis or disinfection. So he used to disinfect his instrument, that is any surgical line or instrument with the solution that is called as carbolic acid solution. This is carbolic acid. He disinfected even the sutures also, suture materials, threads, silk, and black silk, all suture materials he used to disinfect with the carbolic acid. Okay, carbolic acid. And one more name I want to tell you. Who invented the germ theory? Louis Pasteur. Louis Pasteur invented the germ theory. That means most of the infectious diseases, communicable diseases are from the germs. That is bacteria, virus, fungus, all these things, germs. So depends upon the theory of germ theory that is invented by the Louis Pasteur. This man, Joseph Lister, he introduced antisepsis. And also one more pioneer was there, Edward Jenner. Who is he? Edward Jenner. Vaccine, cowpox. He invented vaccine. Depends upon the same germ theory, he invented vaccination. Okay, vaccination. This man, who is he? He is a great man. Robert Koch. What for Robert Koch? Koch. Robert Koch మనకి పేరు వినపడగానే ఒక డిసీజ్ గుర్తుకు రావాలి. ఏంటిది? Tuberculosis. He is the father of tuberculosis. Okay, Robert Koch. So he postulated certain postulates. They are called as Koch's postulates. So they depends upon the culture and sensitivity to grow the organism in the cultures. All these things from the Robert Koch. Okay. వదిలేద్దాం ఇప్పుడు. Next. So these are the organisms like bacteria, virus, protozoa, fungus, parasites, helminths, parasites, spirochetes, chlamydial infections. They are all from the microorganisms. Okay. So how a man gets infection in only hospitals? I am stressing only about the hospital acquired infections. Okay. How a patient going to get, or a normal person who is roaming in the hospitals are going to get the infection? Means from this is human cross infection from man to man. This is we doctors, medical students, PGs, and also nurses. Those who are working in the wards, they used to have one dangerous organism on their bodies, on their hair, on their nails, on their skin. What is that organism? Ide MRSA. What is MRSA? Methicillin resistant Staphylococcus aureus. What are the nosocomial infections? Nosocomial infections అంటే తెలుసా మీకు? Hospital acquired infections. Hospital acquired or healthcare related infections. Healthcare associated infections. They are called as hospital acquired infections, nosocomial infections, healthcare associated infections. The most invading organism is MRSA, methicillin resistant Staphylococcus aureus. What is the drug of choice? Pharmacology అయిపోయిన వాళ్ళు చెప్పాలి. Vancomycin is the drug of choice for the MRSA, methicillin resistant Staphylococcus. And also there are some of the modes of the infections. Human auto-infection. Auto-infection means from human to human, that is from the chicken pox and the staphylococcal pharyngitis, wound infections. So this is also from one person to the another person. Okay, all these things going to. From the environment, from the food, clean water, clean food. They are going to prevent most of the communicable diseases. So clean water is, if you are not getting clean water, most of the villages, in the cities also, in the towns also, there is no pure, that is clean, potable water as per SPM. SPM ఎంతమంది ఇక్కడ? SPM చదివారా? అంటే ఇది SPM అంటే ఏంటి? Community medicine. That is converted into community medicine now. Social and preventive medicine. New name is community medicine. So community medicine students ఉన్నారు ఇక్కడ? ఉన్నారు కదా? So we are not, most of the villages in India are not getting potable water, that is clean water, clean drinking water. That's why many of the communicable diseases pertaining to GIT going to occur without the clean water. And also, what are the waterborne common infections? What are the waterborne infections? Typhoid, malaria through a mosquito, only from water. Cholera is not more now, but it is there. Inkodi jaundice illeda, jaundice, hepatitis A, most frequent occurring jaundice, hepatitis A, typhoid, and also gastroenteritis, rotavirus from the infected water. That is okay, rotavirus. All these things going to happen from this. Okay, so like this you have to remember all these things. So from the environment, from the food that is infected food, and also the solution that they are called as water, and also from the IV fluids in the hospitals, from the IV infusions. IV means IV infusions, intravenous fluid infections, and also from the endoscopic procedures. Endoscopic procedures, if one person is having the endoscopic investigation, the scope will be passed into the esophagus and also the stomach and also up to the second part of duodenum. What is the organism found in the stomach? H. pylori, Helicobacter pylori. If that endoscope is not cleaned properly, this Helicobacter pylori is going to invade into the endoscope. That endoscope, if we put in another person, the Helicobacter pylori transmits into the another person. Helicobacter pylori is going to produce what? Peptic ulcer, type 2 peptic ulcer, type A, type B. Type B persons are having peptic ulcer with the infection of Helicobacter pylori. Okay, Helicobacter pylori. So these are the things. So from air and dust also we are going to get Staphylococcus aureus. What are the skin commensals over our body? ఇప్పుడు మనకు అందరిలో ఉంటుంది, ఏపరన్ల మీద ఉంటుంది, హెయిర్ మీద ఉంటుంది, స్కిన్ మీద ఉంటుంది, ఎక్కడంటే అక్కడ ఉంటాయి. What are those organisms? Staphylococcus aureus, Staphylococcus epidermidis, Streptococci, beta hemolytic Streptococci, and also Propion. These are the skin commensals, common skin commensals. That's why we have to wash our hands. Wash our hands. Okay, next entity. So these are the modes caused by the airborne infections, waterborne infection, that is contaminated water, and also from the pathogens through the bloodstream, that is bloodborne infections. Bloodborne infections means that through the blood transfusions or touching directly the blood. What is that organisms going to be caused from the blood? Commonest diseases: hepatitis B, hepatitis C, HIV. Okay, these are going to transmit from the body fluids. Okay, body fluids, and also from the infection caused by the contact with the fecal-oral solutions, that is fecal contact. All these things going to produce infections. And next, this is infection cycle, that is infectious agent, reservoirs will be there, and also portal of exit, means of transmission, portal of entry, susceptible, all these things. This is called as infection chain. We have to break this chain. We have to break this chain. How we are going to break this chain? I will tell you. So what are the stages of infection? That is infectious process through a organism, that may be bacteria or virus or fungus. There is some incubation period for every organism. What is the incubation period called? What is incubation period? From the time of the entry up to the causing the disease. Ippudu cheppandi. What is incubation period for HIV? What is window period? What is window period? That is not from the time of the entry and up to the appearance of the first symptom. That is not window period. Window period is entry of the virus into the body till that person becomes positive for HIV. That is window period. What is window period for HIV? How much time? How many days? 6 weeks to 12 weeks. Window period. That is not the appearance of the disease. It is only appearance of bacteria in the serum, in the blood. Okay, that is window period in case of HIV. It is not infectious period. HIV infection means that is different. That is called as development of AIDS complex, acquired immunodeficiency syndrome complex. Okay, AIDS complex. Next, so this is incubation period, and thereafter going to put a prodromal stage, inlet stage, convalescence. So these are the stages of infections. And also this is epidemiological triad. You know about this very well in the community medicine. There is pathogen or agent. This is environment and also host. This is the epidemiological triad. And this is going to be, this is healthcare associated infections worldwide. But USA, because they are having advanced medical fraternity, medical field, so they are going to detect organisms as early as possible than the remaining countries. So that's why USA healthcare associated infections are worldwide is more. That means it is not in the meaning of they are having more infections. The detection will be perfect there. So this is MRSA and also Staphylococcus. What are the gram-negative bacilli going to occur in case of nosocomial infections, hospital-acquired infections? Gram-negative dangerous bacilli. Enti? Greenish pus. Clue istunna. What is that? Pseudomonas. So in case of surgical, మేము సర్జన్స్ భయపడే దానికే సర్జన్ భయపడే దేనికి రెండింటికి భయపడతాం మేము బాగా వణుకు మాకు దేనికి ఎంఆర్ఎస్ఏ సూడోమోనాస్ MRSA and Pseudomonas. These are the two organisms going to bother the surgeons because they are going to cause wound infections, serious wound infections, and that wound. These organisms are going to produce wound disruption, abdominal disruption, burst abdomen. All these things going to happen. Okay, next. So who are more prone for the infections? Children and the adults because they are having lesser immunity in their body. So children and also adults above 60 years, 70 years, because they are having lesser immunity, they are going to have infections frequently. So the motto here is an ounce of prevention is worth a pound of cure. That means prevention is better than cure. Pound అంటే how many grams? అది తెలవాలి కదా ముందు. How many grams equal to a pound? Mathematics, physics, mathematics. 453.6 grams is a pound. That means 2.2 pounds are 1 kilogram. Isn't it? Okay. So like this, what is an ounce? 33 or 34 grams. Okay, ounce. So that means this line indicates prevention is better than cure. So what is the important cause of infection here? So this is they are going to this is infection prevention. What is important in infection prevention means we have to follow. We are going to fear about the wound infection, especially SSIs. SSI means skin and soft tissue infections. In case of surgeons, post-operative care, we are going to affect very badly with this. And also, what we are going to do here now, break the chain of reaction. That is chain of infection. Wherever here, that is from the entry into the up to the causing the disease, we have to break this chain to prevent the infection. Okay, this is from the infectious agent, reservoir, transmission, entry, all these things. We have to break the chain wherever it is possible. Okay, and this from microorganisms during surgery, how they are going to reach the surgical site. That means surgical site infections. Surgical site means from the contaminated inanimate objects including instruments, sutures, linen means dresses, and also swabs, solutions, mattresses, blankets. All these are going to infect the surgical site wound. And also we have to follow certain aseptic precautions to prevent these infections. The main precaution we have to follow this. What is this? Hand wash. Hand wash. After hand wash only we are going to keep the IV cannulas and certain tubes into the body and also these infusions also. Through the aseptic precautions we have to follow certain aseptic precautions. Otherwise we are going to land in this type of wound infections, wound disruptions and the wound dehiscence. This is called as wound dehiscence. So that's why these people are more prone for infection. That is pregnant women, neonates, elderly, and as hospitalized patients, patients with chronic diseases, and also the patients with immunosuppression, especially HIV infections, and also those who are having cancer patients under the treatment of immunosuppressants like azathioprine or any cancer drug, anti-malignant drugs are going to produce immunosuppression. All these patients are more for the one that is infections. So that's why we are going to have medical asepsis, surgical asepsis, medical asepsis. So what is medical asepsis? Medical asepsis is before going to the patient. That means if the patient is admitted in the ward, before touching the patient, after touching the patient, after touching the patient's environment, that is linen and also bed sheets, all these things. If you are going to touch any patient's belongings, after touching the patient belongings, you have to wash your hands. before touching the patient, after touching and examination the patient, after touching the patient's belongings, you have to wash thoroughly your hands to protect yourself, and also if you are going to another patient, that patient has to be protected. Two uses of this hand wash. You are going to protect yourselves, and also when you are going to the other patient, you have to protect him also from this patient's infections. Suppose if this patient is having scabies or any skin diseases, suppose you touch and examine the patient, with the same hands if you are going to touch the another patient, means you are the transmitter here. So you are going to transmit the infection from one patient to the other patients unknowingly. So that's why you have to wash thoroughly hands, or at least you have to use surgical or sanitizers, hand sanitizers. You have to use the hand sanitizers. That's why I am going to teach you now what is the procedure of hand washing and also aseptic glove wearing. Okay, what is this? What is this? Cap, head cap, to put the hair inside this cap. Okay, your hair should not fall over your shoulders or anything else. While you are working while you are roaming in the wards also, your jada. జడని ఏమంటారు ఇంగ్లీష్లో నాకు తెలియదు, ఏమంటారు మా జడని? నాకు మళ్ళీ చెప్పండి, ఇది ఇంకో దగ్గర వాడతాను. ఇది ప్లేట్, పిఎల్ఏ ఐటీ ప్లేట్. న్యూ వర్డ్. ఇప్పుడు చూడండి, నా నుంచి మీరు నేర్చుకుంటున్నారు, మీ నుంచి నేర్చుకున్నాను. ప్లేట్. సో యువర్ ప్లేట్ షుడ్ గో ఇన్సైడ్ యువర్ యాప్రాన్. ఎంతమంది కొంచెం చూద్దాం ఇక్కడ, ఎంతమంది ఉంది ఇక్కడ? అందరికి బయట ఉన్నాయి, చూసారా? అందరికి బయట ఉన్నాయి. దిస్ ఈస్ నాట్ గుడ్ ప్రాక్టీస్. ఓకే, గుడ్ ప్రాక్టీస్ ఈజ్ యువర్ ప్లేట్, యువర్ జడా షుడ్ బి ఇన్సైడ్ యువర్ అప్రాన్స్. ఎందుకు తెలుసా? సపోజ్ ఇఫ్ యు ఆర్ గోయింగ్ టు ఎగ్జామిన్ ది పేషెంట్ లైక్ దిస్, సో వెన్ యు ఆర్ palpating the patient or percussing the patient or inspecting the patient or auscultating the patient, your jada will fall over the patient. Your jada will fall over the patient. Your hair will touch the patient. He is already admitted in the hospital. He is infected. That infection will come to your hair. That hair will spread all over you. It is going to infect you also. That's why your jada should be in the apron. అర్థమైందా మీకు ఎందుకు చెప్తున్నాను? You have to prevent yourself. జడ ఎప్పుడు అప్రాన్ లోపలే ఉండాలి. మా క్లాస్మేట్స్, మా జూనియర్స్ తర్వాత ఒక 3-4 బ్యాచెస్ వరకు జడ లోపల ఉండింది. దాని తర్వాత జడ బయటకు వచ్చేసింది. This is the danger you are going to face. Suppose if you become house surgeons, interns, when you are working in the wards, you are doing the wound dressing, you are cleaning the wound, so immediately your hair will fall over the wound, your hair will get infection. From the hair you are going to get the infection into your body. That's why you have to put your plate inside the apron. So this is to prevent the falling of the hair. This is cap, the hand. This is separate surgical dress. How to wash the hands? You have to wash your hands for up to 40 to 60 seconds to reduce the growth of the germs and hands. Hand washing going to prevent the germs or bacteria from our hands up to 80 to 90% only. Not totally, but that 80 to 90% prevention is very important. Reduction is very important, because your hands will not become sterile. Your hands will be having a certain amount of bacteria still, certain bacteria or spores. Even after washing your hands also, but the body immunity will take care of it. Okay, body immunity will take care of it. So what is the procedure of hand washing? ఇప్పుడు మీరంతా ఇప్పుడు హ్యాండ్ వాష్ చేయాలి. సరే, ఫస్ట్ ఆఫ్ ఆల్ మీకు ఎంతవరకు తెలుసు హ్యాండ్ వాష్? మీకు ఎంతవరకు హ్యాండ్ వాష్ తెలుసు? జస్ట్ అలా వెళ్తారు, సోప్ తీసుకుంటారు, చక్క తీసుకుంటారు, అది పడేస్తారు దాన్ని. లేదంటే డెటాల్ సొల్యూషన్ తీసుకుంటారు, వాడేసుకుంటారు. జస్ట్ యూ హ్యావ్ టు ఫాలో వాట్ ఐఎమ్ గోయింగ్ టు టీచ్ యూ నౌ. కాన్షియస్లీ యూ హ్యావ్ టు ట్రైన్ ఇన్ ఇట్. It will follow you in future. Consciously you have to get the training now, because you learned something from your childhood, but I'm going to furnish it. I'm going to modify it. Okay, the modified thing you have to practice consciously while you are washing the hands. This will help you in the future. Okay, even after going into the PG also, our professors were not taught regarding what is the procedure of hand wash. We learned ourselves. This should not happen to you, because we are going to train you from now itself. Rather than after attending the PG, you are going to train from now itself. Just get up from your seat. Underlined ఒకసారి. Stand. ఇప్పుడు నాకు చెప్పండి. How are you going to wash? There are 6 steps in hand wash. నేను చెప్పినట్టుగా చేయాలి. 6 steps in the hand wash. First, the most ideal hand wash is if it is elbow tap. Elbow tap means the tap will be having a steel rod. So we are going to close and open with the elbow. That is better and ideal tap. Ideal tap. Okay. Or otherwise we are not having ideal taps like in our hostel and this so many hospitals also we are not having this. Some hospitals are having sensors. Sensors. So if you put your hands, water will fall. This will be in the malls. IMAX malls వెళ్ళారా? మాల్స్లో ఉంటుందా ఇట్లా హ్యాండ్ పెట్టగానే వాటర్ పడుతుంది. కానీ అటువంటి మాత్రం మన ఓటీస్లో ఉండవు అవి. ఎందుకని మన ఓటీస్ కొద్దిగా అంటే మనకి ఇది లేవు, డబ్బు లేవు కాబట్టి అటు ఉండవు అనమాట. అట్లీస్ట్ దట్ ఈస్ elbow taps are very important. Elbow taps. So you are going to the tap, opening the tap. There is water flowing. Water flow should be there. Proper water flow should be there to clean your hands. Okay na? So just putting your hands under the water. First of all, you rinse your hands. ఇప్పుడు నేను ఏం చేయాలంటే ఈ కోట్లన్నీ పనికిరావు. ఇప్పుడు a surgeon, the most beautiful dress for surgeon is OT dress, surgical dress. జీవితంలో దాదాపు సర్జికల్ డ్రెస్ ఉండిపోతుంది మ్యాక్సిమం టైమ్ ఆఫ్ అవర్ లైఫ్. నెక్స్ట్ ఆ డ్రెస్ అదే మాకు ఇష్టం. ఇవన్నీ ఉత్తుత్తివి పైన అలంకారాలు ఇవన్నీ. యాక్చువల్ డ్రెస్సెస్ పోతే అప్పుడు ఉంటుంది లోపల ఆపరేషన్ చేయడంలో. సరేనా? సో ఏ సర్జన్ ఇలా ఉండడం మంచిది సర్జన్కి. ఎలా? అవోది elbow dress is better. So we love our surgical dress very much. Okay, అది ఉంది తర్వాత చేసుకుని చూపిస్తాను. అయితే అది కూడా మీరు వస్తారు. So now we are going to open the tap. So you have to be, your clothes should be above the elbow. At least 2 or 3 centimeters above the elbow joint. Okay na? So just open the cap, rinse your hands. So before washing the hands, this types of ornaments, ఉంగరాలు, వాచీలు, గోర్లు ఏం ఉండకూడదు. చాలా మంది ఉంగరాలు వేసుకుంటారు, కానీ వాచ్ వేసుకుంటారు. తీయమ్మ ఉంగరాలు సిస్టమ్ ఇదే సిస్టమ్ చేసి ఏమి సిద్ధపడ్డా మొన్నే నిశ్చితార్థం అయింది అని అది ఫింగర్ అది ఉంగరాలు పెట్టుకోవడం. హ్యాండ్ వాష్ రిమూవ్ ఎవ్రీథింగ్. చూడండి ఇప్పుడు చేసుకున్నాకన్నా మధ్యలో చేయలేదు, చేసింది కూడా నేషనల్ ప్యాంటు షర్ట్ మాత్రం ఉంది. ఇది కూడా తీసేసి సర్కిల్ రైస్ చేస్తున్నా. ఓకేనా? సో rinse your hands in water up to the elbow. So there are 2 types of hand wash. Simple or general hand wash for the handling the patient, handling the food, okay, handling the food, and the surgical hand wash. Surgical hand wash should be up to the elbow. So simple general hand wash. Okay, rinse in the water first. Take the soap or liquid soap like that or ideal preparation. Ideal preparation means betadine solution, betadine surgical scrub or any betadine solution. So we are having alpha related solutions also. They are only hand sanitizers. Okay na? Hand sanitizers. So beginning scrub is there, just taking some scrub or solution or any liquid soap or any normal soap also, just apply the soap up to middle of the forearm for the general wash, up to the elbows, above the elbows, up to the for the surgical scrub. Next, step 1. Apply together. Step 1. Change immediately here. Step 1. This is step 1. Step 2. Just scissoring the fingers like this. Step 2. Scissoring the fingers or interlocking. Step 2. Step 3. Reverse. Reverse. Step 3. Here, here. Step 3. This is going to remove the dust in the left stretches. They are called as dust stretches. Step 3. Step 4. ఇప్పుడు ఏం చేస్తాం కదా, ఇదేం చేసిన పట్టణం ఏం చేస్తుంది, ఫోటోలు ఇది కదా వచ్చారు కదా, ఫోటోలు ఇలా చేయండి, ఇలా చేయండి, మీ ఇష్టం. ఓకే, సో యూ హ్యావ్ టు కీప్ ది ఇన్హలేషన్ హియర్. ఓకే, step 4. Okay. Next, step 5. There is heavy dust, heavy amount of bacteria in the nail beds. So how to remove those bacteria? You can interlock your hands like this. You can wash, but this thumb and this, then you have to go like this. Go like this. This is. In the soap water only, you have to do like this. This is step 5. Step 5. Something like that. What is it? ఏం చేస్తారు, మళ్ళీ ఏం చేస్తారు, ఏం చేస్తారు, రిస్ట్. సో యూ హ్యావ్ టు టేక్ ఇట్ విత్ సేమ్ సో యూ హ్యావ్ టు డూ లైక్ దిస్. ఓకే, దిస్ మూమెంట్ సో దిస్ ఇస్ ఫర్ జనరల్ హ్యాండ్ వాష్. ఓకేనా, ది సేమ్ థింగ్ we are going to continue like this up to the elbows. Up to the elbows. So continue like this up to the elbows. 2 centimeters above the elbows. This is step 7. 7 steps for the surgical scrub, 6 steps for the general wash, general hand wash. Okay? And then, yes or no? So first you are going to wash your hands maybe with simple soap. Second wash should be with the surgical scrub solution, that is decadent solution in case of surgical procedures. For normal hand wash, the 2 times with the same soap itself is there. Okay, na? So now we are going to touch the tap again. Mali open chestara. Okay na? Chestara mali open chestara. Wash chestunaru. Mali open chestara tap ni. Em cheyali? Vere vallu pote adi open cheyali. Otherwise elbow tap ni easy. You can operate with the elbow. So when you see, ఎలా కడగాలి చేతిని? చేతిని ఎలా కడగాలి? ఏ డైరెక్షన్ లో పెట్టాలి చేతి? ఇలా పెట్టాలా, ఇలా పెట్టాలా? ఇలా పెట్టాలి. From hand to elbow, the direction of the flow, the direction of the wash with the water should be from hand to the elbow. From hand to the elbow. And then ఇలా కదా. So all the dust will again fall over hand. Okay. From hand to the elbow. From hand to the elbow. Wash it. ఇప్పుడే చేస్తారు, వాష్ అవుతుంది కదా, వాటర్ పడుతుంది. ఇప్పుడు చేయాలా, చేస్తారా? చేయకూడదు. Should not. Because again this water will come into your hands. This will cause again. You have to hold your hands like this. Here, not above the neck, not below the waist. This is the principle here. Not above the neck, not below the waist. Yeah. Agar operating table ఉంటుంది. Or for the simple general hand wash, take a clean towel, wipe it. Have you done? For the surgical scrub, surgical hand wash, before doing the surgical procedure, go to your table, surgical table, that is operating table. So there will be a clean, that is sterile towel, may be there, may not be there. You can take a sterile towel, wipe your hands up to the elbow and throw it. Then you have to take the apron. You have to take the apron. So you are circulating must in the theater. You tie the apron. Then you are going to wear the gloves. Glove wearing. Gloves okay na? Till that period, your hand should be like this. Till that period, your hand should be like this. Hands up. Hands up position. Hands up. Ilana పెట్టుకోవాలి yes sir అంతేగాని ఇదే హ్యాండ్స్ వెళ్ళేసి ఎలా ఉన్నా నీ గడపలేము ఈ డ్రెస్ బాగుంది నీకు అని ఏంటో డ్రెస్ క్లాస్ చేయకూడదు సాకూడదు షుడ్ బి లైక్ ఎ సోల్జర్ డిసిప్లిన్ అంటే డిసిప్లిన్ అంతే సర్జరీలో if you become certain this discipline you have to maintain. You should not touch any object in the theater, anything in the theater after hand wash, unless only the apron and gloves. Okay na? ఇప్పుడు గ్లోవ్స్ వచ్చాయి కదా గ్లోవ్స్ దగ్గరికి వెళ్తారు సో అప్రాన్ వేసుకున్నారు అప్రాన్ ఇక్కడ ఉండలేదు తెలియకుండా అప్రాన్ మనకి ఉందా అప్రాన్ ఉంటే ఇవ్వండి సో దిస్ ఈస్ గ్లోవ్. This is a sterile surgical glove. This is sterile glove. This is having a wrapper. Sterile glove. Okay na? Sterile glove. This size is 12.5. There will be many sizes. Size number 6, size number 6.5, 7, 12.5. It will be like this. You have to open the glove. This paper is also sterile because it is sterile in the ETO. Ethylene oxide sterilization or gamma radiation sterilization period. I will take the glove like this. This is the glove. Okay na? This is the bead. This is the glove made up of latex. This is the bead of the glove. This is the pocket here. Pocket. So this gloves and these are the fingers pockets. This is the folded glove heads. Okay. So first you hold the glove like this into the folded margin. Put your hands, 4 fingers, like that. Put your hands, 4 fingers, then slide it inside. When you are sliding, you put your thumb inside this. Okay? Then leave it. And then you will adjust it. Leave it. Okay? Then again, this is left hand glove. Okay? This is washing hand. Touch this. If there are any adhesion, this pulley is going to release adhesion. Then you insert these 4 fingers of the right hand into the pocket, folded pocket of the glove, like this. Then insert these 4 fingers into this. While inserting, you can insert the thumb also, like this. Then there is a stretch you can adjust. Then with this hand, you touch only the bead of the glove, bead, then you adjust. This is the wearing of the glove. This is the glove wearing. So we will supply the gloves for you. You have to show us. How they will be wearing the glove. Okay? Okay. So I will read. So glove is a 30%. Each one has some tissues and things you must know. 5 minutes. The glove 5 minutes. Then how are you going to remove the glove? So you have a surgical procedure, IND, or dressing, or anything else. Or any dirty procedures, dirty operations, we have done this. So the glove is oiled. How are you going to do? How are you going to take out the glove? There is a procedure for this also. Alright hand and left hand to right hand. Touch here. Stretch it. remove in the reverse direction. Reverse is this one, reverse. Then hold this with this. Hold this. Then you press the bead of the opposite floor. Slowly. Otherwise, you are going to touch with your soiled hands, your elbow, or your jaw, or you are going to touch. So your skin will be contaminated. This is the way of the glove and the removal of the glove. So we are going to supply you all of you the gloves. You are going to show us. Okay. So hand wash. Step 1. Step 1. Step 2. Step 3. Step 4. Step 5. Step 6. This is for the general hand. Step 7 for surgical hand wash. Then again. And then wash your hands. Wash your hands on the air. Really, actually your white fruit. So you are actors now. Actors. 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 Then, how are you going to hold your hands? Like this. Like this. Then you are going to wear the glove. How are you going to do your procedure? First of all, you are going to take the apron, wear the apron, then wear the glove. So now, the procedure I taught you, this is called a non-touch technique or no-touch technique of the wearing glove. No-touch technique or non-touch technique or open technique. 3 names are there for this technique. 3 names are there. There is one more technique is there, that is closed technique. If there is apron, I will show you. Otherwise, give prayer. Okay, na? So this is the hand washing and glove wearing. Push and push and push and hand washing and glove wearing. ఇలాగే చేయాలి మీరు హాస్టల్లో కూడా వెళ్ళినప్పుడు consciously you have to do this like this. All these things will take around 40 to 60 seconds. At least, but in the book, it is said that you have to wash your hands at least for 2 minutes. For 2 minutes. But I am telling you, if you are going to practice this, you can finish this within 40 to 60 seconds. Consciously you have to practice this. So ఇంతవరకు నేర్చుకున్న హ్యాండ్ వాష్ ఇప్పుడు నేర్చుకున్న హ్యాండ్ వాష్ you follow the steps only. So what happens now? You will get some satisfaction also. My hands are very clean. This satisfaction will continue. My hands are very clean now. I follow the procedure. I follow the protocol. My hands are very clean now. Okay, this much of satisfaction you get. Next, the procedures. Is this the right way? Keeping the hands like this after wearing the apron and glove. Is the right way? Right or wrong idea? Right or wrong? Even after wearing the apron, even after wearing the gloves also, you have to make like this. Okay, you are telling that patient ability. After when you are going to the patient operating table also, you have to hold your hands like this. After wearing the apron and the gloves. Wearing the surgical apron and gloves also, you have to, your hand should be like this, not like this. Otherwise, you can touch anything here. Anything in the vicinity of the operating table, you can touch. Again, your hands will get infected. Contaminated. Yes, septic. Okay? No, you have to go like this. So this procedure is wrong procedure like this. After wearing the gloves, this is also a right technique. You should not touch like this. If you are like the style, but photos are they are not sisters or nurses. They are only the actors. That is also wrong thing. ఇంతవరకు బాగానే ఉంది, ఇంతవరకు బాగానే ఉంది, ఇదే బాగాలేదు. ఓకేనా? దిస్ ఈజ్ రైట్. నెక్స్ట్, సో యూ హ్యావ్ టు హ్యాండిల్, యూ హ్యావ్ టు sterile the instruments and also surface of the tables, surface of the body with the certain disinfectants like this steam method, drying it, boiling method, radiation method, and also this method. This is the sterilization procedure. This is called a sterile. This is called a sterile. And so five incidents you are going to wash your hands before touching the patient, after touching the patient, after touching the patient's belongings, before doing a surgical procedure, after doing the surgical procedure, because you are going to the body fluids of the patient. What are the body fluids? You may touch the gastric aspiration, you may touch the saliva, you may touch the urine, you may touch the blood, you may touch the serum of the patient, or you may touch the fecal matter also. Anything that you will touch with the body fluid, contaminate your hands. So after doing this procedure also, you have to wash your hands. In these five incidents, before touching the patient, after touching the patient, after touching the patient's belongings, before doing the surgical procedure, after doing the surgical procedure. These are the five incidents you have to wash your hands. It prevents yourself and also the patient. Okay, now? So this is Edward Jenner. Edward Jenner, he is the pioneer of the vaccination. So he has done the co-pass vaccination. He invented the vaccination for the, what is the disease which is eradicated from the world? Smallpox. There are only two smallpox are stored in the two countries, one is Russia, one is America. Still this smallpox is stored in the minus degrees. Smallpox virus. Okay. So that's what is the recently eradicated one? In India, there is no polio virus. Polio is free in India. These are eradicated because of the vaccination, active vaccination, active immunization, Okay. So gender. So these even attending the units also we have to wash the hands. So after attending the units, we have to wash the hands because our hands are having so many MRSs. If the MRS is going to infect this newborn baby, he may die also. Okay, no? So this is neonatal intensive care unit. NICU, neonatal intensive care unit also we should be very careful in touching this, in attending the children. And these are the, what is biomedical waste disposal? These are uses syringes and also dressing material. All these things are going to produce infection. We have to take care of this biomedical waste also. How they are going to be taken care of? So because the person exposed to the risk of infection is sanitation workers. You know the sanitation workers? 3% of hospitals. Those who are taking the biomedical waste, they are high risk personalities to get the hospital infections. And also ourselves. Second comes we. First is sanitation workers. Second case comes we, that is the medical and paramedical staff. Third is the patients and visitors. Patients and visitors. Patients and visitors going to get hospital infections. Next, what to do with this? This symbol is very important because this symbol is going to give an indication about the disinfections. Okay. So this is general waste, that is kitchen waste, so wrappers, papers, all should be in the black bin. Okay, sir. And this is the yellow bin. Yellow bin, this is placenta, and also this is biopsy materials, that is appendix specimen is there. So like this, with the contaminated biomedical, that is body fluid contaminants, should be kept in the yellow bin. Also blue bin, that is sharp objects like syringes, catheters, cannulas, gloves, all this tube, all should be in the blue container. This is waste bags are there with the symbol, plastic bags have to go all these things. We have to segregate the biomedical waste. How this biomedical waste will be disposed? Disposal of the biomedical waste through the incineration, disinfection, sterilization, landfill means landfill total parameter. Landfill and land disposal or initialization. So all these things are going to dispose this. And What is the object ultimately? To prevent the infection only, and also for the proper waste disposal. Proper waste disposal. So you learn today. Gloves ఉన్నాయి ఇంకా వెళ్ళి gloves ఉన్నాయి ఇంకా ఎక్కడ ఉన్నాయి ఇంకా చాలా gloves ఉన్నాయి కదా సరే gloves స్టార్ట్ చేస్తారా? సరే gloves ఉన్నాయి స్టార్ట్ చేయండి. నేర్చుకున్న వాళ్ళకి